I mean, are we at an inflection point? You had the attacks in the fall on healthcare. Now you have the Scripps attack, which took them really offline for the better part of 3.5 to 4 weeks. Has the conversation shifted, and all the other industries for that matter? We had the meat industry this past week. We had the pipeline as well. Is the conversation shifting? Is this an inflection point where this is finally going to get on the CEO's table and they're going to demand a plan and say, look, we can't afford to be shut down, or boards saying we can't afford to be shut down? Are we feeling that kind of inflection point happening here?
Well, I think with the new rules that have come down from the Biden administration, that certainly cascaded into the healthcare and all communities, but certainly that's a transition there. So that will spark some conversation. But I also have seen a change, particularly in healthcare in the last year or so, where because of some of these attacks, maybe even starting back with WannaCry in 2017 that did such damage to the NHS, I'm now seeing a change where people are starting to talk about security and patient safety in the same conversation, patient care, right? And they're now realizing they have to go hand in glove. And all of the investment used to just go towards medical things that were pertaining to patient care. So I do think things are changing a bit, and something like the recent gas one was something that really, I think everybody could relate to that one a little bit more maybe than some of these. They've heard another hospital's been attacked or another bank, but when it starts to be that the West Coast or the East Coast all of a sudden can't get back and forth to work or get critical equipment transported to their place of business simply because we can't get gas, it brings it closer to home.
Gosh, I like to think we're at an inflection point, but I guess a cynic in me says we probably aren't. I mean, WannaCry should have been an inflection point. I mean, it was a tremendously significant ransomware attack. It's the ransomware attack that took down hospitals, okay, albeit in the UK, but they had to stop surgical procedures kind of mid-operation, right? They had to close down EDs and ship people to other hospitals. I mean, this was up at that point kind of like the poster child of like what could go wrong in a health system from a ransomware sort of attack. And we didn't heed that warning then. So I guess the cynic in me says, well, what happened to Scripps is very noteworthy because it's a significant institution that had this attack. I hope healthcare learns from it. I suspect maybe we have to go through this cycle a couple more times before we truly get it.